In this procedure, you will learn how to perform a nebulizer treatment on a patient. Begin by plugging the nebulizer into a properly grounded electrical outlet. Confirm the patient's identity by asking for his name and date of birth.
How are you today?
I'm good. How are you?
I'm David. I am Dr. Jones's medical assistant. I'm just going to be working with you today.
Okay.
Okay. Could you please give me your full name and date of birth?
Kevin Heron, and 5'10".
To put the patient at ease, explain the purpose of the nebulizer treatment.
Have you had a nebulizer treatment before?
No, I have not.
Okay. Dr. Jones has ordered one for you because of your recent diagnosis of asthma.
Okay.
It's not a painful procedure. I'm just going to use the sanitizer, set up the nebulizer, and we'll get rolling on that.
Okay.
Okay.
Before beginning the treatment, sanitize your hands. Perform the 3 routine medication checks. Insert the drug into the nebulizer medication cup. Connect the disposable tubing to the medication cup and then to the nebulizer. The patient should be sitting upright to allow for total lung expansion. If using a mask, position it comfortably but securely over the patient's mouth and nose. If using a mouthpiece, instruct the patient to hold it between his teeth with his lips pursed around the mouthpiece.
What I'm going to have you do is when I turn this on, you're going to see the mist coming out. Once you make a good tight seal with your mouth.
Encourage the patient to take slow, deep breaths through the mouth and to hold each breath 2 to 3 seconds to allow the medication to disperse through the lungs.
Okay.
Take slow, deep breaths in. When you breathe it in, try to hold that breath in for about 3 seconds, and then slowly let it out through your nose.
Okay.
If you can't hold it for the 3 seconds, like you feel like you're going to cough or you're short of breath, it's okay, just let it out. The longer you hold the medication in, the more of its job it can do.
Turn on the nebulizer. The aerosolized medication should be visible as a mist. Continue the treatment until aerosol is no longer produced, or approximately 10 minutes. If the patient is receiving a bronchodilator, such as albuterol, he may experience dizziness, tremors, or tachycardia. Continue the treatment unless otherwise ordered by the provider. Turn off the nebulizer. Ask the patient to take several deep breaths and to cough loosened secretions into disposable tissues.
Take a couple Kleenexes, and you're going to cough any secretions, anything you have in your lungs after that treatment, into those Kleenexes, okay? I'll get you the trash can in a second. Good. Keep coughing that up. Good. The more it comes out, the better.
Put on a pair of gloves and dispose of the mouthpiece or mask and tubing in a biohazard container along with the gloves. Instruct the patient also to dispose of the contaminated tissues in the biohazard waste container. When you're finished, sanitize your hands. If the patient is to continue home nebulizer treatments, provide patient education for both the patient and caregivers as appropriate. Ask him to demonstrate the treatment steps to confirm his understanding.
I'm going to teach you how to put your medication in at home if you're doing your nebulizer.
Okay.
Here's the medication.
Okay.
Just make sure to always check the outside of the foil label here, just to know you have the right medication, right dosage.
Okay.
It'll twist right there in the top, so you can peel that out.
Okay, like this?
Yeah, it should tear.
Okay.
Good. And take the little vial out.
Okay.
And on it will also have the name of the medication that you can check.
Oh, okay.
Good. And then you just twist that top.
Like that?
And, yeah, and it'll pop right off.
Okay.
And then I'll hold the cup, or you can hold the cup. There you go.
And I just put it right in there?
Yeah, just pour all the contents in there. You'll need
Okay.
all that medication. Good. Here, and I'll take those from you.
Okay.
Good. And then all we have to do is hook it up to the nebulizer and put the mouthpiece on, and you'll be ready to do this at home.
Okay. All right.
Okay.
Document the nebulizer treatment, the patient's response, including the amount of coughing and whether coughing was productive or non-productive, and any side effects of the medication.